Hi, my name is Pri, and this is my video of doing a full body assessment. Hi, my name is Pri. Am I able to do a full body assessment on you?
Yes.
Nice. Okay. First thing we're gonna do is wash our hands. Okay. Can you give me your name and your date of birth?
Perry Pierce, April 10, 2001.
Nice. I'm comparing the chart to the bracelet, which is two forms of identification. Okay. So the first thing that we are going to do is check for neuros. Can you tell me the month and the year?
September 2025.
Can you tell me what city you're in?
Bridgeport.
Okay, can you tell me why you're here?
For a full body assessment.
Nice. Client already addressed his name. He is completely oriented ×4. The first thing I am going to assess is the head and the neck. First, I will check for symmetry. You just lift your head up like this. Nice. Okay. Ears are symmetrical. Nose is completely midline. The mouth is also midline. There is no lesions on the client's face. Skin is very much intact. The next thing I will do is check the pupils. With my pen light, can I ask you to remove your glasses? Thank you. Okay. Residence pupils is equal and reactive. I will now be assessing an oral cavity. Can I ask you to open your mouth? Okay. No sores, no lesions. Mucous membranes are moist, which is within normal activity. The next thing I will assess is the upper body. So I will be first looking at the upper extremities. I will be checking the temperature. Resident is warm to the touch. Color is within normal range of ethnicity. Okay. I will also be checking the pulse bilaterally on the radial pulse. Okay. Okay. Residence pulse is both equal, and I checked it for 30 seconds and it is 82. Okay. The next thing I will do is check for capillary refill of his fingers. I'm going to ask you to flip your hands, and I'm going to check your refill on all your fingers. Okay. Response is brisk in less than 2 seconds. The next thing I will do is check range of motion in the upper extremities. Okay, I'm going to stick on your arm and I'm going to move it. Are you having any pain?
Nope.
Okay. I'm going to bend your arm here. Are you having any pain?
Nope.
Can you roll your wrist? Any pain?
Nope.
Nice. I'm going to check the other side. Are you having any pain?
Nope.
Are you having any pain?
Nope.
Can you roll your wrist? Any pain at all?
Nope.
Nice. Okay. So the resident is within a normal range for range of motion. The next thing we're going to do is check sensation. Okay, can you close your eyes? Can you feel what I'm touching?
Yep. My arms.
Which arms?
Both.
Okay. Resident is able to feel sensation in bilateral arms. The next thing I will do is listen to his pulse for a whole minute. We will listen at the PMI, which is in the 5th intercostal space. Okay, I'm gonna raise your shirt. Is that okay?
Yes.
Okay. Just hold on to that for me. Thank you very much. Okay. Resident has a regular rhythm, nice and strong. Okay. The next thing we're gonna do is looking at the chest. Okay. I'm gonna take a look at your chest today. You want to put your glasses back on? I'm sorry.
Of course.
Thank you so much. Okay. Assessing symmetry of the chest. Skin integrity is good. No abnormal markings. Resident is noted to have tattoos, which is normal. I'm gonna check for skin trigger by the neck, by the clavicle. Okay. Skin did bounce back, so that is within normal range. It looks very well. Next thing I'm going to do is auscultate the lungs, anteriorly and posteriorly. Okay, every time I move, I want you to take a deep breath, okay? In and out. Nice. 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 One more time. Nice. One more time. Okay. I'm just gonna ask you, can you face this way? I'm going to listen posteriorly. Lungs are clear. Interiorly, clear auscultation. I will now listen posteriorly. Okay, go ahead. Okay. Nice. 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 One more time. Nice. Okay. Lungs are clear. Ooh, sorry. Lungs are clear to auscultation posteriorly. I will now be assessing the abdomen, so I will ask my client to lay down supine. Nice. Thank you. Okay. Sorry, my stethoscope keeps getting caught in my hair. That's all right. Okay. Now visualizing the abdomen. Noted resident does have a tattoo on the abdomen, which is normal. The skin is intact. Everything is here. I will now auscultate the abdomen. If I can get my stethoscope out of my hair, I will do that now. There's a technical difficulty. All right. I will start by listening in the right lower quadrant. Okay, resident does have active bowel sounds times 4. I will now be palpating the stomach. Are you having any pain at all?
Nope.
No pain?
Nope.
No?
Nope.
Okay. Good. Okay. Resident denies pain anywhere in the abdomen. The next thing I will look at is now the lower extremities. So I'm going to pull down your shirt, and then I'm going to raise your pant legs up, okay? It's a little fitted there. Alright, I'm just going to lower these just a little bit. Assessing the skin. It is cool to touch bilaterally. Skin is intact. I'm going to take off the resident's socks also, just so I can assess the temp of his feet also. Okay. Feet is cool to the touch. I will check the pedal pulse also. Sorry, no, you can keep your feet the way it was. trying to catch it. There it is. All right, nice. Resident has strong pulses bilaterally in the pedal pulse. The next thing I will do is assess the strength. Okay, so I'm gonna ask you flex your feet, flex, and then I'm gonna ask you to push against my hand like you're stepping on the gas pedal or clutch. Okay, flex, push, flex, push. Nice job. Okay, so Resident does have equal strength in the lower extremity also. I will be checking for capillary refill in both of his feet. Okay. Resident has a brisk return and is less than 2 seconds in the toes. I will be checking for range of motion in the lower extremity. Okay, I'm just gonna lift your leg. Any pain? Any pain? Any pain? Any pain? Any pain? Any pain? Nice. Okay. Resident denies pain of any part of the lower extremity in the 3 major joints. I will roll this down. The next thing I will do is actually assess sensation. Close your eyes. Can you feel what I'm touching?
My right leg and both legs.
What about now?
My right leg.
What about now?
My left leg.
What about now?
Both legs.
Nice. Resident does have sensation in bilateral lower extremities. Okay, I will don the socks on. And now I will give education. All right, Mr. Pierce. Okay. So we are now completed with your full body assessment. Everything is within normal range. Okay. I do want to let you know that you can also do your own full body assessment at home. You are able to kind of test the waters a little bit, and you are able to see if anything changes, and if it does, make an appointment with our MD and we will give you an appointment for you to come back. Okay.
Okay.
Do you have any questions at all?
Nope.
Nice. Okay. I will now wash my hands. And that is the end of the assessment. Thank you.